everyone, I am Mark J. Gutangogan and my topic for today's video is all about home and community health care. The role of communities in improving health is receiving increasing and long overdue attention in health policy and practice. The need for this focus has been underlined by experiences during the COVID-19 pandemic. Stronger recognition of the role communities can play in and their greater involvement in efforts to improve health and well-being are needed if there is to be a successful move to a population health approach and a reduction in health inequalities. As part of this shift in focus, integrated care systems need to take the role communities can play in improving and sustaining good health seriously, working at the place and neighborhood level where the link of communities is strongest. There is a long history to draw on and much expertise. For example, in local government and the voluntary sector of working with communities for health. But the approaches that are used are understood in many different ways and can be confusing. While this explainer cannot do justice to the full range of approaches, it is a starting point for those wishing to understand more. We provide a styling list for those who want to explore this topic further. The King's Fund is actively working in this area, part of its program of work on healthier places and communities. So first, let's proceed to the next topic. So what is a community? Community is a group of people joined together by a common interest, characteristics, or experience. The definition adopted by the National Institute for Health and Care Excellence sets out a number of factors that can define a community as they relate to the experience of health, including geographical location, race, age, faith, or related need. Specific context of health and care services, the term community can also be used in other ways to describe a group of people with similar health needs. For example, a group of people with diabetes or a group receiving similar health services. For example, a group of patients receiving the same diabetes intervention, or a group of people who help shape or provide services. The local voluntary and community sector often supports and represents such communities and also provides services to them. Then let's proceed to the next topic. What is community and why is it important? Community health is a medical patients which focuses on people's well-being in a particular geographical area. The essential public health sector covers programs to help neighborhood members in protecting and improving their health, deter the transmission of infectious diseases, and plan for natural disasters. Importance of community health. A healthy community benefits every person in it, and community health is one means of achieving a healthy community. The field of public health aims to protect and improve health by addressing the structures of systems that define a place and by supporting the people who live and work there in making healthy choices. Home and community care. Home and community care services or home care provide individuals with nursing care and support for personal care and daily living activities when they are no longer able to perform these activities on their own. These services help people to stay in their own homes rather than go to a hospital or long-term care facility when they need nursing care or help with daily living activities because of age, disability, injury, or illness. You can receive home care services if you have a valid NWT health care card or Phil health card and have been assessed and found to the needs best met by home care. Home and community care services help people to receive care at home rather than in a hospital or long-term care facility and to live as independently as possible in the community. Home and community care is delivered by regulated health care professionals such as nurses or non-regulated workers, volunteers, friends, and family caregivers. Home care includes services such as home support for bathing and making meals, nursing services or wound care and health checks, help with organizing and taking medications, palliative care for those who are dying and want to be at home, loan equipment such as bathroom equipment or a walker, and respite care to help out in the home so caregivers can get a break. If If you or a loved ones needs any of these services, please contact your local health and social services authority, home care programs, or community health center. What is the role of communities in improving health, and why is it important to know how its natural concepts? There is now widespread recognition that communities have a vital role in improving health and well-being. There are a number of overlapping reasons for this, including the following. First, the communities people are born, live, work, and socialize in have a significant influence on how healthy they are. Although estimates vary about how much influence, these factors have a much greater influence on health and well-being than health services. For example, we know that under certain circumstances, social isolation and loneliness can be as bad for health as risk factor such as smoking. There are many assets within communities such as skills and knowledge that can be mobilized to promote health and well-being. From a healthcare perspective, communities have great insight and intelligence on what they need from health services and on what works in improving health. Linked to this, directly engaging people from the most marginalized groups and those most likely to be affected by health inequalities is important in addressing these inequalities through both formal health services and other means. Overview from this section. The approaches to communities and health set out below are related to, but distinct from, those that support the greater involvement of individuals as patients in health service design and decision making, and from the commissioning and provision of formal community health services. The focus of communities and health is broader and is about how people, bound by common experiences, characteristics, or interests as set out above, improve or are helped to improve their health, and where the solutions to health problems are not solely about the provision of formal health and care services in the community. This topic is the public policy and the role of communities in health. Recognition of the important link between communities and health has grown as in recent years. This has been reflected in the growing importance and voice of community-focused organizations and partnerships and through national programs and policy. Multi-community includes behavioral health and social services, emergency management and public safety, recreational and natural resources, public health agencies, environmental health, planning and community development, non-governmental organization and business community, and health care delivery systems. Health is in the end or the means to an end. Communities can benefit by understanding how much health is connected to the other goals important to them. And improving education, housing, or employment can also help improve health and mitigate health inequality. Health policy plays a vital role in the general wellness and safety of a population. Based on the given needs of a community, public health policy establishes clear goals and solutions toward total health. The role of communities in health promotion. WHO or World Health Organization has defined community engagement as a process of developing relationships that enable stakeholders to work together to address health-related issues and promote well-being to achieve positive health impact and outcomes. There are undeniable benefits of engaging communities in promoting health and well-being. At its core, community engagement enables changes in behavior, environments, policies, programs, and practices within communities. There are different levels, depths, and breadths of community engagement which determine the type of and degree of involvement of the people. For conclusion, home health care is a wide range of health care services that can be given in your home for an illness or injury. Home health care is usually less expensive, more convenient, and just as effective as care you get in a hospital or skilled nursing facility or SNF. Community health focuses on an overall geographic area rather than on shared characteristics such as age or diagnosis. The defined area could be as small as a neighborhood or it could encompass a city or an entire region. Policy communities are groupings of government agencies, pressure groups, media people, and individuals including academics, WHO, or World Health Organizations for various reasons have an interest in a particular policy field and attempt to influence it.